All right, let's get more reaction now to the signing of the NHI Bill into law. The President earlier on saying that the state is trying to build what he calls, and I quote, a Rolls-Royce system of healthcare for all South Africans. So let's speak now to Dr. Donald Gumede, chairperson of the National Healthcare Professionals Association. Dr. Gumede, thank you so much for your time this evening. The President saying that the NHI takes a bold step and stride towards a society where no individual must bear an untenable, financial burden while seeking medical attention. How do you react to the signing of this bill into law?
I've got a lot of mixed emotions about it because the bill itself or the idea of NHI is a good idea. But then the execution thereof, I think that's what concerns all of us. Because universal health care is a good concept that actually was going to help the whole general population in South Africa. But then the problem, like I emphasized from the beginning, it's the execution thereof. And then here are the pointers of the whole situation. You see, I'm happy that you even mentioned that the President mentioned that he wants to build a Rolls-Royce situation in South Africa concerning health. But then the practical things which are glaring are as follows. We do not have infrastructure, in our country as far as the health systems are concerned. We don't have the human resource that is employed. We have got 1,000 doctors and many other pharmacists and other healthcare practitioners who are actually there sitting and loitering and not doing anything, whilst we are actually dreaming of this Rolls-Royce healthcare system. I mean, let's first employ these 1,000 doctors to show that we have the capacity to do the fancy stuff that we talk about.
Yeah,
and then, yeah.
Pardon me, Dr. Gumede, for coming in there. The President saying that, there are those who have fears, detractors. We always talk about the negatives, but what they're trying to do is to make sure that everyone has access to equal healthcare services. But, when you speak about the issue of infrastructure, just 2 days ago, I was in conversation with Nehau, and they were saying that while this is a concern for them, but they do believe that we have to start somewhere in order to be able to build. But do we have quite a good place to start in order for us to be able to address some of the concerns you're raising?
Wonderful. Yes, you see, that's where I spoke about execution, because unfortunately our government has not been very good at giving us hope as far as administering state-owned enterprises, as you know. All of them, they run them down. So to answer your question, you see, let's look at history and see what have they done with the SOEs that existed, your post office, your DNL, your SA, all of them. You see, they needed leadership and proper administrative qualities, but then they were run down. So now you are looking at this other one, which is actually not even yet born. And to complicate issues, you don't know, even yourself, how much you're going to be charged. Because there's no free lunches. It's not true that the government is going to give you free healthcare system through NHI. You're going to be paying for it. So someone has to pay for it. So that's where our concern is all. It's all about to say who's going to pay for it and for how much.
And when you talk about finances, I mean, listening to the President, he says that the financial hurdles can be navigated with careful planning, strategic allocation of resources, and a steadfast commitment to achieving equity. He's emphasizing the point of achieving equity, but he's talking about strategic planning here. So are you saying that this particular strategic planning will need much more than just words and also these allocations in order for things to be clear?
I'm very happy that you mentioned that. How many times have we had strategic planning of smart cities, houses in Alexandra and blah, blah, and all that? I mean, there are many of those promises, ma'am. In health, we need a proper strategy to say we know that Mrs. X or those who, or Mr. X who are working, they're going to be paying 30 Rand per month from their salaries. We're going to deduct it. And then we know You know, we cannot have a situation whereby, like at the moment, the bill is signed, and then you don't know how much you're going to be contributing. I mean, NHI is not stranger to here in South Africa, ma'am. In UK, in 1948, they had the NHS, which they ran until now. It's actually the wheels are coming off. And what has happened is exactly what the concerns that we are raising now. To say you need technocrats, people who know how to run the systems. Because if you don't, you're going to reach a situation whereby it's unaffordable. Because every year you're going to have an increment in the salary of the deduction salary of the general masses.
And
so
Dr.
that
Gumede,
is going to clock them.
there was, I remember in 2012, I mean, there was talk of some 10 districts that have been identified in order to pilot this. And of course, these included, for example, your Tshwanes and all of that. Did it work?
Yeah, you have done your research very well. Actually, I was going to talk about it in any way. As we are talking today, 60 doctors who are in the pilot study, they are not paid. It is the 15th of the month now. They are not paid for the work done in April. They have not paid their bonds. They have not paid their cars. Those pilot studies which were done by it's called the FPD, the company which was doing that, it failed this money. So we are implementing something that has already failed. The pilot studies that they've done have not yielded any positive results. They know, and it's a fact. So my problem is simple. Let's look for what will work. Because at the moment, like just to give you statistics, we have got around 130,000 beds, combined private and public, right? Servicing almost 60 million or 52 million people. So the infrastructure, we are way behind as far as the infrastructure is concerned. So even if you were to say that you are opening the private sector to accommodate the public sector, it's not going to work. We don't have enough capacity at the moment, to tell you the truth.
So what does it mean then? Because earlier on in the briefing, the president says that he's noticed some improvements. He even says that, he's amazed when he goes to some of the rural hospitals, the equipment that he sees there. Some of the elderly people don't have to queue for their medication. They simply go to the window. There's computers and all of that. You are in this field. Is that their reality?
No, it's not. It's not. It's far from it, to be honest with you. I can put my head on the block. I mean, the fact of the matter is our health system, to be honest, I was in another program sharing with this issue to say, our health system is dilapidated. It's the fact. You go there, the stench is there. The stench is there, the buildings are dilapidated. I mean, you don't need a rocket scientist to tell you. Let's be honest now. You don't need a microscope to look at what I'm talking about. I mean, it's there. And then, like I'm saying, they're trying now to even cut the overtime of doctors who are actually employed in the public sector. Why? Because they can't afford to pay them. It's a fact. It's a fact.
I know that the minister earlier on kind of made light of this particular point, but there are some South Africans who are saying that right now this bill has been signed into law, so that means tomorrow I can go to a private healthcare facility without medical aid and I'll be able to be attended to. Let's answer that question.
No. That's a fallacy that was created for politicking. The fact of the matter is, even if the NHI has to be implemented the way it was supposed to be, or to be done. It has to be done in phases, you see, meaning you have to start from somewhere and then you grow it. It's like a growing tree. You cannot just say tomorrow, I'm going to wake up and then I'm going to the private sector. It's not going to happen. There's a lot of things which are involved. You have to be registered as the private sector. We have not signed any contract with NHI or with the government. So there's no way that tomorrow people can come to Dr. Gumede's practice and say, no, now the bill is signed, NHI is here. There's a lot of things that needs to be done. People have to be allocated numbers, which you may call it a health insurance number of NHI, and they have to belong to a certain section of the health parameters where they live, so that they go and consult from that. That's to have your practice has to be fully equipped to be catering for those NHI patients and all that. So it's far from it. This actually, it might even take another 2-3 years to maybe start implementing the first stages of NHI.
All
so
right.
It's far from it.
So there's a question from, in fact, we have a number of questions from the viewers, but I'm going to pick one
Sure.
from Opa as he asks that what is the benefit then, particularly for the people? So what are the benefits of NHI in your view?
You see, the idea, like we said, it was to try and normalize the situation that was created after 1994. Because 1994, everybody else who was sick went into a public hospitals, for that matter. So we had our clinics, our secondary hospitals, tertiary hospitals, and all that in the country. Now, what happened is, we now diverted into two tiers of healthcare, whereby the private sector, or those who didn't want to go now to the public sector, because maybe it was administered by the new government, if you were to call it that way, they created the private sector, you see, where now it was for the elite, those who could afford, those who had money. So healthcare became a kind of a commercial enterprise, you see, rather than being a right, which actually is in the Constitution. So now the problem that created that is that those who have, they went into private hospitals. Those who didn't have had to queue for 2 days or 3 days in public hospital, which is effective enough to today.
And I'd like us to take another comment from Melikaya, who seems to also be raising some of the concerns there. And Melikaya says, I'm not sure about the government's readiness and financial obligation to make this a reality. Why did they not stabilize the dysfunctional public health system first, employ all the unemployed health professionals, then bring this NHI? And this goes back to what you've had to say earlier on. So then, we're hearing now of legal action that is to be taken against this particular bill. Do you support that then in order to maybe try and get some answers?
Yes, correct. But then you see the other thing also, the guys who are going for the legal action, they are actually looking after their own interests. Because remember, in the medical aid space, they are covering between 14 to 16% of our population, right? So now, if everybody, like now the president has signed, they won't want to have dual payment, where they're paying for a medical aid and they're being deducted for, which is taxed somehow from the NHI. So they'll rather maybe dump one, because even now in the medical aid strata, they actually reduce their, most of the members, they're no more on standard medical aid or high comprehensive, as they call them. They are on network or low plan, you know, because they can't afford them. Now, if you give them an option to say they can go and see a private practitioner for a lesser amount, for maybe one grand or 1.5, they'll obviously dump the medical aid. So the medical aids are going to close down. So
some of them, then you're saying briefly, they are protecting their own interests because they're about to lose their income.
Yes, correct, 100%. That's a fact. We cannot beat about the bushes about it. It's a fact. That's why, you see, you will see the number one people who will go into the courts of law is the medical aid industry. They're the ones who will run there, because their survival is dependent on what I've just said now.
Dr. Gumede, quite an interesting conversation, and thank you so much for answering our questions, as many of them as possible, and hopefully we get to speak again, because this does look like it's one of those stories that is going to be multifaceted with many different layers and different reaction. That was Dr. Donald Gumede, chairperson of the National Healthcare Professionals Association.